Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Welcome everyone, my name is Ashley Klein-Jimenez and I am from Prevent Connect in Cal Casa, and today you're joining us for our web conference on community level indicators, advancements in evaluating sexual, domestic, and other forms of violence prevention. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or Cal Casa. So I'm really excited to be back with our friends at Prevention Institute. I want to hand over the podium actually to Alicia. So Alicia Somji is our facilitator today, and Alicia, I'm going to let you introduce Carmen.
Hi everyone, good to have you all on our web conference today. This is Alicia Somji, and with me here I have Carmen Kurtz, who is a program assistant, and I'm going to be helping with anyone who sends messages to the Prevention Institute account. So if you have any questions, you can always send private messages or public messages to the text chat. And we definitely encourage you to participate through the text chatting function through the web conference with any questions, comments, and feel free to interact with each other as well. So as you know, our web conference today is focused on community level indicators. And we're going to be exploring the importance and feasibility of community level evaluation. We'll be exploring how to use these types of indicators in prevention work. We'll identify community level indicators of risk and protective factors for violence prevention across multiple forms of violence. And we'll, as always, engage in a candid discussion through the text chatting and with the guests orally about community level sexual and domestic violence prevention. So to start us off, you've heard me say community level a lot already. So we do want to ask you, what are the community level changes you're working towards in your community to prevent sexual and domestic violence? Or if you're focused on other forms of violence, you can answer for those. And by community level changes, we really mean what are you doing to change the physical built environment, or things like social connections, norms in your community, or maybe even things like educational and economic opportunities. So we would love for you to share in the text chat what kind of changes you're working on. And while you're doing that, I'm going to move forward a little bit and we'll come back to the text chat. So at Prevention Institute, we have something called the Unity Roadmap, which is all about effectiveness and sustainability for violence prevention. And it goes through kind of the who, the how, the what, of what it really takes for preventing violence. We're currently updating this tool. It includes a gauge for you to see where you're at. So we can share a link for the current version, which is from 2008. But we will be updating it in the coming year, so stay tuned for that. Within the Unity Roadmap, under how, one of the core elements is data and evaluation. And in evaluation of violence prevention, we've learned a lot over the years, and these are some lessons that have come about specifically from some work in LA. And violence prevention what we've learned is violence prevention requires a long-term commitment. So what that means is just looking at rates of violence, they can fluctuate week to week, month to month, year to year. And when we're focused on prevention, it can be really difficult to know what to evaluate in addition to just those rates, since it is something that requires a long-term commitment. And so we've learned that looking at indicators such as the risk and resilience factors, or things like community involvement or youth engagement, are other things we can be looking at in addition to just those rates of violence. We've also learned that it's essential to evaluate an overall strategy to violence prevention, and not just looking at an individual program level, but overall, how are the things we're doing in a community really contributing to preventing violence in the first place. And the last point here is about the importance at focusing at a community level. It's a very actionable place to be working, and you know, it helps us move beyond just individual behavior change or focusing on one person at a time. So I did want to share this socio-ecological model. I think many of you are probably familiar with it, but for those of you who are not, it kind of helps us see the different layers of, you know, looking at individuals, relationships, community, and society. And with violence, I think often people go to the individual or relationship level, but we need to think about how our community contexts are actually shaping our relationships and our behaviors and our exposures. And it can be an efficient and effective way to go about prevention strategies. And so if we're focusing at a community level, we also need to be thinking about our indicators at that level as well to be able to measure not just individual changes, but again, more of that community level change. So I wanted to share this quote, which says, "The indicators a society chooses to report about itself are surprisingly powerful. They reflect collective values and inform collective decisions. A nation that keeps a watchful eye on its salmon runs or the safety of its streets makes different choices than does a nation that is only paying attention to its GNP, gross national product." And so as we're talking about community level indicators today and, you know, making the case for them, it reminds us to think back to, you know, why are we choosing to report on the things we're reporting on, and what do we really want to be reporting on, what matters in our communities. So with that, let's turn back to the text chat and see what's been coming up for people. Ashley, anything to share?
Sure. So I think there were a lot of really great examples of you know, important work being done at the individual and relationship levels. And then there were some examples of people who are working more at the community level. So folks who are working on community connectedness, looking at policy. There was a mention of someone using the CDC Stop SV technical package to inform and guide their work. Some work around economic supports, and looking at place-based health equity focused strategies. Those are some of the things that I saw come up, Alicia.
That's great, yeah, and looking quickly right now, I see a lot around norms change as well, and focusing on masculinities and what that means. Seems like people are also thinking about policy and things like campus or school climate. So great to see people thinking about things in these ways. So hopefully as we go through the web conference, you can be thinking about the work you're doing at a community level and thinking about how some of the indicators that our guests may share or lessons that they share relate back to your own work. So with that, I would like to introduce our guests for today. So first I'm introducing Wendy Siebolt, who is the President and Senior Research Associate at Strategic Prevention Solutions. She specializes in prevention research, program planning and evaluation, community coalitions and collective impact, assessment of organizational and community capacity for prevention, and evaluating a criminal justice response to intimate partner and sexual violence. Ms. Siebolt holds advanced degrees in health education and behavior and community psychology, and is recognized as a national expert in the prevention of intimate partner violence and sexual violence, who for over 16 years has trained communities to prevent violence while emphasizing scientific rigor within a realistic community context. Ms. Siebolt lives in Juneau, Alaska. So Wendy, just want to make sure that we can hear you. Do you want to say a quick hello?
Hello. It's 80 degrees and sunny in Juneau, and I just had to brag. Pretty good for a rainforest, at least for a couple of days a year.
That's great. And I'd also like to introduce Dr. Teresa Armstead, who serves as a behavioral scientist in the Division of Violence Prevention at the Centers for Disease Control and Prevention. She earned graduate degrees in community research and action from Vanderbilt University. And prior to CDC, she served as Assistant Director and Evaluator of the University of Iowa's Prevention Research Center and held faculty position in the Department of Community and Behavioral Health. Dr. Armstead is an expert in public health program evaluation, having led or supported evaluations in the area of physical activity, intimate partner violence, youth violence, HIV and AIDS prevention, and the CDC Ebola response. So our guests today come with a wealth of experience both in intimate partner and sexual violence prevention, as well as really understanding evaluation. So be sure to post questions that you have for them in the text chat today too. And Wendy, Teresa, do you want to say a quick hello as well?
Hi, everyone. It is hot in Atlanta. That's pretty much all I need to know.
That's funny. And I see someone on the text chat just said they're from Atlanta, too. So great to see more folks in there. So to start us off, Wendy, why should practitioners and advocates in the sexual and domestic violence prevention field consider community-level indicators in their work? And if it's helpful, feel free to first define community-level indicators for us.
Okay, great. Well, hi, everybody. It's really exciting to join you today. This is a topic that is near and dear to my heart as well as Teresa's, and I'm sure many of you out there as well. A secret connection that Teresa and I have is that we are both trained as community psychologists, and if you don't know already, you'll soon find that we are very biased towards looking at community-level everything in our work. And so looking at community-level indicators to evaluate and assess our impact with violence prevention efforts is a really important topic for us to be discussing about, and we're excited to hear about what you've all been working towards as well. I think you got an idea of what community-level indicators really are by what Ashley and Alicia were reporting back from what they saw in the chat boxes when you all were listing out your efforts at community-level change. I really want to emphasize that social-ecological model, and I think it was Ashley who was saying that there were some norms work that were being mentioned, and also economic policy, and trying to separate out what exactly is that community level versus an individual level of like attitude or awareness change, and even bystander stuff. That's all individual level, even or relationship. And so today we're really going to kick it up a notch, and I'm really excited to have Teresa talking with you all about their findings and their paper, and give you a lot of good examples of what community level indicators really are. So just keep in mind that an indicator is really helping you, it's the data that indicates the presence of a factor that puts the community at a higher or lower risk of experiencing a problem. That's one way to think about it. And keep in mind that it's a risk or protective factor for a community, not just individuals in the community. So kind of start wrapping your head around that, and we'll talk more about it in a few minutes. A couple of about four main reasons about why we're changing this conversation to really focus on community-level indicators these days are covered in Teresa and her team's paper that I think you all have access to, and you'll hear a lot more about in a few minutes. One of the main reasons is to be able to quickly communicate your progress and your impact to stakeholders. So a lot of you may have heard of dashboards or scorecards that are used to report out on various indicators of improvement of a certain issue or problem that a community or organization or coalition is focused on. These are usually quantitative. They're quickly accessible or digestible to the people you give them to, so it's really helpful for decision makers to be able to track a percentage of a population that's experiencing something or a percentage of policies. And it really helps you quickly get across your impact to stakeholders. Also, we're not going to get into too much detail about this on today's call. Teresa's going to talk about it a little bit, but there is a problem with just averaging or aggregating individual level data and calling it a community level indicator. And I'm guilty of this too because of a lot of the lack of data that we have at community level indicators. So I'm excited for you all to learn more about what Teresa has to say about community level data, and try and challenge you all to really think about how can we, instead of, for example, take all these like 30 students in a classroom and we survey them all about their perceived norms, and then we call that an assessment of the norms of that population or community level norms. How can we assess norms without just aggregating all those individual scores. We know from educational research and evaluation for the last 40 years, they've struggled with this because of that exact example of averaging students to make some bigger number come out of that. And there's special statistics that have been developed to be able to handle that, like hierarchical linear modeling. And that's something that's pretty advanced and not something that's really feasible for local practitioners to be doing. And so we can talk more about that at another time or over coffee, but that is a big issue, the measurement issue. Also, as any of you who have done surveys and evaluation, you know that collecting individual level data is time consuming and resource heavy. So conducting surveys, doing focus groups, talking to people individually, it's great data and can be used for many purposes, but it's also very time consuming and resource heavy. Also, there's the issue of populations that may be harder to reach by collecting individual data. What happens if you, for example, do a survey at a time of day when a certain population might be more likely to be at work or not available to participate in your survey? Then you've ended up with biased data, and it's missing the data from those people who weren't able to attend. So there's bias in every data, but that is one type of bias that you can run into with individual level data. Real quick. Go ahead.
Oh, I was just going to say, so measuring, we know that measuring community level factors can seem really daunting or expensive. So how do you make sure your indicators are appropriate for your purpose?
Thank you. Yeah, this is a distinction that people are starting to talk about, I've noticed, in a lot of our nonprofit settings, and especially in domestic violence or intimate partner violence, sexual violence prevention. There is a little bit of a difference that I want to draw between doing program evaluation and finding indicators that will help you evaluate a specific program versus looking at population indicators. And again, we won't go into this in too much detail today, but I just wanted to put this seed in your mind as you listen to all the examples that Teresa is giving you. Just keep in mind that program evaluation outcomes, so on the right side of the slide, are usually tied to specific program components. So for example, if you're implementing shifting boundaries in a school setting, you might be looking to measure student norms of aggression towards others, or looking at the policies at the school setting related to school bullying. You might be looking at individual knowledge of boundaries and personal space. Those are tied to very specific components of the Shifting Boundaries program. And so if you don't deliver one of those components, you probably won't impact some of those outcomes. And that's part of what helps you unpack the story of the impact of a program. It helps you use evaluation to improve your program. You can also be collecting data for evaluation at one time point, or oftentimes multiple time points, but within a short period of time, so like a semester or school year, not over a 10-year period. And qualitative data is also oftentimes very helpful for program evaluation, oftentimes too because it's tied to that idea of using your evaluation results to improve your specific program. Population indicators can also help you with program evaluation, and Teresa's going to touch on that with her examples, but there is a little bit of a distinction in the sense that they are population level, and oftentimes the larger population or more generalized population than your specific program might be reaching. And so we're looking at long-term indicators for a lot of these indicators, not all, but some of them. Just like Alicia was commenting on, violence prevention takes time. And so population indicators become really helpful to be able to track your community's change over time. You can collect them at multiple time points, and the data itself is usually publicly accessible, which is a nice feature. It's not wrapped up in like an academic study that may or may not be published and publicly available for free or cheap. And the notion that population indicators is neutral is something that I'm actually going to come back to at the end of this webinar, just to touch on, because they're often viewed as neutral numbers, like, hey, it's just the percent of people living in poverty, or the percent of people at an economic disadvantage. And so it's seen as like an objective neutral number. And that's for the most part true, but I do want to acknowledge that there's bias, like I said, in every kind of data. And when we talk about big data, like community level indicators oftentimes tap into, we need to think about certain populations that are missed or inadequately represented in those databases as well. But we'll get to that later. Just as a closing thought with the idea of community level indicators, I oftentimes think of this visual of a tree in the forest. And I know there's all sorts of jokes about if a tree in the forest fell, would anyone hear it? But pretty simply put, if you look at something from an individual level, so one tree was felled in a forest, that tells you a certain type of story about that one tree. But when you actually step back and look at perhaps a larger context, and it looks like more than one tree is experiencing something, it's a whole different story that's told. And so it helps you reframe not only your view of the problem, but also how you address the problem by looking at it from a completely different level or larger stepped out level. And that's why the social ecological model really helps us use this as an analogy, because that one tree is affected by the context in which it lives. It's in a forest. And so if a larger percent of trees is experiencing a problem, that starts to become a community level or forest level issue. And so the solutions we pick for it might look very different than if it was just the one tree. And I think with that, we're going to turn it over to...
Yeah, thanks, Wendy. And I think that what you're sharing really helps us get to the root of the problem. So with that, let's turn it over to Teresa and learn more about her community level indicator research. And then we'll bring Wendy back to get more into some examples. So Teresa, can you start off with sharing what's the background on why you did this research?
Sure. Thanks, Alicia. So we set out as a team, to conduct a comprehensive, not necessarily exhaustive, literature review for indicators of risk and protective factors for violence prevention. When I joined CDC about 7 years ago, there was this common refrain that there are no community-level indicators for our work. And as a community psychologist, as Wendy mentioned, I thought, well, that can't be true. There has to be. But violence was new for me as a topic. So, when we set out to do this work, we thought that perhaps we were looking for needles in a haystack. But, this was a project that I had long been interested in pursuing. So our goals for this study and this research was really to identify community-level indicators, to provide a summary of usable indicators for researchers and practitioners, hopefully highlighting some innovative indicators, and really to support the improvement of program evaluations. So we know that prevention takes time to show an impact on violence outcomes, and what we, as an evaluator, I also claim that particular title, as an evaluator, we know that again, prevention takes time, so we need some kind of marker to show that we are making progress or working toward that change that we seek. And so we were looking for indicators that could do that, and hopefully some low-hanging fruit indicators. So connecting the dots, so the CDC and Prevention Institute publication, Connecting the Dots, really provided the framework for our review. It was published in the same year we began the project in 2014. And for us, it established that different forms of violence were connected, reinforcing that we have a good chance of preventing multiple forms of violence simultaneously if we focus on shared risk and protective factors. This was one of our first attempts by this review, conducting this review, to respond to feedback we were getting from the field asking for more support in using Connecting the Dots.
So I know we want to launch a polling question right now and ask the audience, are you familiar with Connecting the Dots? So on my screen at least, it's showing up on the bottom left. So it's A, B, or C. So A would be yes, it informs my work. B would be yes, but I haven't really used it. And C would be no, I have no idea what Connecting the Dots is. So people's answers are coming in. It looks like, give it a couple more seconds here. So it looks like we're pretty even across all. It looks like we're almost like a third, a third, a third for each of the three categories. So we do have a mixture of folks here, but it does seem like, so 38% are not familiar with connecting the dots. So Teresa, maybe you'll be able to give a little more context on it as you're talking.
Yeah, I'll definitely try. Yeah, thanks. Let me see. So just, well, a refresher and maybe new for some of you, and I'm not going to personally go into a lot of details on the resource, but please, for more information about it, there's a source at the bottom, so don't forget to, when you get these slides, look for it and have a chance to look over Connecting the Dots for more information than what I plan to share. But just as a refresher, a bit of a refresher, so in Connecting the Dots, there are these risk and protective factor tables. And on these tables, what you see across the top are the different forms of violence. And then along the side and down the side, you see shared risk and protective factors. And really what Connecting the Dots, again, showed us and was able to demonstrate was that there are a number of overlaps across different forms of violence and these risk and protective factors. And this particular table is showing risk factors at the societal level. To manage the scope of the review that we did, only studies that measured, that were connected to only studies that measured risk and protective factors that were common across 4 or more forms of violence and occurred at the community or societal level were included. So in Connecting the Dots, actually, let me say, they looked at risk and protective factors across the social-ecological model. So they did look at the societal, community, relational, and individual level, but for our study, we focused on the community and societal level. At the time when we started our review, media violence and societal income inequality only had a demonstrated relationship with 3 forms of violence, but right as we began, and then too far after to include it, but right after we began the study, societal income inequality did meet our criteria, so we were able to include that in our review. The community risk factors. So this table is at the community level risk factors. And what I want to say here, and there will be more to say later, is that these risk factors you see are really categories of risk. The way each risk factor was operationalized and measured varied across the different forms of violence, and from study to study that was included in Connecting the Dots. And so if you want to know more about how each factor was measured, and if you go to the Connecting the Dots resource, you'll be able to see the references for their study. Okay, and then this last table I want to share from Connecting the Dots are the community level protective factors. So access to mental health and substance abuse services did not meet, as you can see, our criteria. So it was only 2 forms of violence at the time of Connecting the Dots publication. And coordination of resources and services among community agencies, although it did meet our criteria of inclusion, we found that that particular protective factor is often measured using qualitative methods like focus groups and interviews. So there weren't any predetermined community level indicators that we could identify for inclusion in our study.
Thanks, Teresa. So we have shared the Connecting the Dots resource that talks all about the links between multiple forms of violence in the text chat right now as well. So if you're wanting to see more about that for more context, you're welcome to do so. We do want to go to our next slide. 1 second here. And ask another text chat question. So I know, many of you are using Connecting the Dots as well from that polling question. So we would like to know, for those of you who have been using this resource, how have you been using it, and which factors do you focus on? So I know many of you may have mentioned some earlier on in the web conference, but if there's anything specific you'd like to share here, please feel free to use the text chat. And while people are doing that, Teresa, what was your research process for searching, screening, and selecting the community level indicators that you did across the different forms of violence?
Okay, so briefly, a CDC librarian ran the database searches for us, and it returned over 2,800, if you can believe it, abstracts for us to review. We first screened the abstracts and then selected articles for further screening using additional inclusion criteria. And for more detailed information, because I know we don't have the time today, about the process, please consult the publication. From the database search phase up until the indicators review, we whittled those 2,800 articles down to 259, which is still quite a lot. Once we reviewed those and reviewed the indicators in them for duplication and construct validity, meaning, did they measure what they said they were measuring, that kind of thing, we reported on indicators that were found in 116 articles. So we had quite a lot of information, quite a lot of indicators in our tables. For the purpose of our review, community-level indicators were included if they met any definition of a community at any level or unit of analysis. So that means the communities could have been geographic, virtual, at the neighborhood, county, or state level, and they could have been measured with census tract or census block group level data. Indicators for us were defined as observable and measurable metrics, so percentages, numbers, rates, or some other value. We particularly sought to identify indicators reflecting attributes of a community versus indicators representing aggregated individual level perception data, and Wendy's kind of already talked about some of the measurement challenges with that. When we began the review, I know in terms of my thinking, I thought we were going to find indicators of the risk and protective factors that I shared from the Connecting the Dots tables. But instead what we found was that most risk and protective factors are measured indirectly through community constructs. The exceptions are alcohol outlet density, income inequality, and poverty. What this means and what we came to understand at a much deeper level is that risk factors in Connecting the Dots is really a category of risk, and it can take many forms. So diminished economic opportunity, for example, could be experienced by communities in different ways through different community constructs. Specifically, neighborhood concentrated disadvantage was used to establish the link between intimate partner violence and diminished economic opportunity, while unemployment rates was used to connect sexual violence to diminished economic opportunity. These two forms of violence and others share this category of risk, but they're often linked through different community constructs. So the results that I'll share will not directly match this risk and protective factors that were shared in the table, because instead they will be indicators of the community constructs that link violence to those categories of risk or protection.
That makes sense. Going back to the text chat about how people have been using the Connecting the Dots research, I'll hand it over to Ashley, but first, one thing that I noticed, it looks like a lot of people have been using it for training and capacity building and coalition building to really get new partners on board that may be not familiar with the field. So that seems to be kind of the common thread across the responses we've been getting. Anything else you'd like to pull out, Ashley?
Yeah, I see the same thing, Alicia, really looking at, the community partners who are working on those shared risk and protective factors and building those relationships and strategically doing our work across forms of violence. I did see someone who mentioned that they're new to prevention, and so they're, which I think is great if you can use Connecting the Dots as kind of a foundation of how you'll approach this work. So yeah, that's all.
Great. So Teresa, thank you for outlining the difference between the community constructs and how what we see in Connecting the Dots may end up looking a little, or does look a little different from what we'll see in the actual indicator research. So with that, you've been keeping us it's been all a mystery. We'd love to know now, what were the results and the indicators that you found?
Okay, sure. So, all right, so in our reporting, we collapsed a few risk categories together. So in this example, again, you see diminished economic opportunity, and we reported it alongside neighborhood poverty because they were so related. These particular risk categories are related to child abuse and neglect, intimate partner violence, sexual violence, suicide, and youth violence in Connecting the Dots. I'm only going to highlight a few examples of what we found across our results tables because, again, they're lengthy. So just to highlight a few. So take French banking, for example. I think it's an interesting and an innovative indicator for diminished economic opportunity risk category. As neighborhoods with higher levels of disadvantage have less access to traditional banking options and are more likely to have predatory lending establishments, which reduces economic opportunities in the community. I like the economic independence indicator because it's an important reminder that communities experiencing diminished economic opportunities linked to violence are not all in urban areas. Also, this example reminds us that indicators themselves are neutral, and it's how we make meaning of or determine the meaning of high or low scores for those indicators. It's how we value them that makes the difference between measuring risk or protection. So while we do not currently have a lot of established protective factors, as you saw on that table, at the community level, we might begin to study whether high economic independence, as an example, in a community is protective or a risk for violence. Actually, let me go back really quickly. So with the poverty one, I just want to mention that this is a county-level measure of poverty, but for the most part, it is measured as the percentage or proportion of residents, individuals, or families living below the poverty line. So I really did like to find these different ways of measuring things that than typical, those innovative indicators. So for cultural norms that support aggression toward others, we combined that risk factor with rigid norms around masculinity and femininity. And I know a number of you guys are looking to address masculinity and norms around that. So these particular risk categories were related to bullying, child abuse and neglect, elder abuse, intimate partner violence, sexual violence, suicide, teen dating violence, and youth violence, and connecting the dots. So norms are, pretty important to address at a community level. A review by Titterington in 2006, and that reference is in the paper, in the literature review paper, found that gender social-economic inequality index was significantly associated with rates of female homicide deaths. The second example on the table, the structural stigma of sexual minorities. This one I included to share with you guys because it comes from a secondary data source. So it does come from a source that aggregates individual level data. But our more specific criteria around this was that as long as the authors of the articles we reviewed didn't collect or aggregate the data themselves, because again, to the point I think Wendy made, it takes time to do that individual level data collection. So if they didn't aggregate them themselves, then we would include them in our review. So in this way, these are indicators that are still useful for program evaluations that may have limited funding to collect their own data.
So we'll go to the next slide.
Okay, great.
We want to ask another text chat question about which of these indicators that you've seen so far could you maybe look at in your community, and also what questions do you have for Teresa with regard to what's been shared so far? And I also wanted to lift up that we did have someone ask in the text chat how you're all incorporating connecting the dots into your coalition work. So I think this is really a question for the audience than it is for the guests. So please feel free to respond to that question as well, with regard to how are you using connecting the dots with your coalitions. So while you're responding to that, Teresa, you can keep sharing your results.
Okay, sure. Oh, I can move the slides. I'm so sorry. Okay, so community support and connectedness. So this is the protective factor category that we had. And so this protective factor category is related to elder abuse, child abuse and neglect, intimate partner violence, sexual violence, and suicide, and connecting the dots. This first example of institutional social capital is a great example of innovation. The indicators were really too long to include fully on the slide, but I did list some examples out for you. In this example, I want to show that we did find surprisingly, and to my joy, I guess, if you will, we did find some qualitative indicators as measurements. So this particular set would involve conducting document reviews in order to use it in your evaluation. Social capital was a pretty common and commonly used construct to establish the relationship between community support and connectedness in a form of violence. So I just included that so you can see. Neighborhood aesthetics was one I really liked. It's an indicator of a physical environment construct, but it's linked not only to community support and connectedness, but also to poor neighborhood support and cohesion through the broken windows theory. So studies that find the relationship between physical disorder, so things like graffiti, litter, and broken glass. So looking at the relationship between that and violence in the community tend to be mediated by things like collective efficacy, which is simply a measure of people's ability to work together toward a common goal. So, you know, and common goals like advocating for clean streets and safe neighborhoods. So that being said, communities that may have a lot of physical disorder, if they also have connectedness that is manifested, for example, through collective efficacy, where people are working towards clean streets, that can be a protective factor in those communities for violence. Okay, and I know this is related to some other ones, so yes, because poor neighborhood and support and cohesion is coming up. So this particular risk factor was associated with child abuse and neglect, elder abuse, intimate partner violence, sexual violence, suicide, teen dating violence, and youth violence, and connecting the dots. So again, to Wendy's point about the context of the neighborhoods in which we live having an impact and asking those questions, this particular risk factor category is associated with many forms of violence that we seek to address and reduce. The first example, so social disorder, this particular construct was used in a study that we cited that showed that disorder, just like crime in communities, concentrates in a few hot spots. And that additionally, while the lack of disorder problems may guarantee places to be violence-free, having high levels of disorder only predicts violence problems about 30% of the time. So, again, while we're studying these things, we definitely want to be aware of what the literature is showing. And even in our review, we say, where you can, please go back and look at the source article for more information about how they used it and what they found. This social disorganization was a fairly common measure for poor neighborhood support and cohesion. It has a very long history in the research literature for many things, actually. And so community constructs associated with social disorganization theory, we reported it in the poor neighborhood support and cohesion table, but in the literature it's been used to measure community support and connectedness, as well as diminished economic opportunities. And it's an example of how indicators in one of our results tables could be linked to multiple risk and protective factors. And then neighborhood dilapidation. So that is often measured as a subconstruct of social disorganization, but you get a sense here, and again, it's an index of the types of indicators that you can use for this. And this would be more of like so that neighborhood environmental survey is more like an observational scan. Oh, that's the point. The thing I wanted to say about the indexes, so if you see in our paper that a set of indicators are part of an index, it just means that you have to actually measure all of them together to be able to say what's happening around neighborhood dilapidation in the community. So this is just a small sample of the findings from our paper. And if you, of course, want more information or have other questions than I can answer today on the webinar, do not hesitate to reach out to me. Thank you.
Thank you, Teresa, and thank you for doing this very useful research and providing new ways for people to think about indicators that go beyond just individual level. So let's see what's been coming up in the text chat. Ashley, do you want to start off?
Yeah, so there are a couple questions, but in terms of what indicators folks would be interested in looking at, a couple of people reported the gender socioeconomic inequality. Someone said looking at voting rates as an indicator of civic engagement. And then there's a little conversation that's just starting to happen with a comment by Cynthia about a tree canopy cover. So we'll see what comes out of that. But there were also a couple questions, Alicia. I don't know if we want to look at those now.
Yeah, we could probably take one right now.
Yeah, and I think Wendy, it looks like Wendy was responding to Rebecca's question about how social disorder relates to structural racism. And so Wendy says it's important to consider more than one type of data, so bias with one can be balanced with other data. Yeah.
And I think the question about, like that same question about structural racism, it's important to, as we're looking at things at the community level, to think about the larger constructs that are at play. And I know that we usually call those structural drivers, so the unequal distribution of power and resources, and how that plays out at the community level, and how some of these different community level indicators or factors may overlap with each other. And so areas where there's higher, like unemployment, may have higher levels of social disorder, or looking at, even mapping of these things would be interesting too. So I'd like to bring Wendy back, and if you want to respond to anything that you've been seeing in the text chat, you can do that as well. But Wendy is going to really help us take this research to practice. So the question that I wanted to start off with for you, Wendy, is how do we keep measuring community level indicators feasible? Because this can seem, quite taxing.
Right. Yeah, on one hand, while this opportunity to look at community level indicators offers the option of possibly using fewer resources to collect original data or primary data, because you're looking at data that's already existing, at the same time, some of it can feel pretty big. So we wanted to make sure we chatted with you all a little bit about this. And I wanted to first start off by basically giving a shout out to all of you on the phone or in this webinar who have been working to apply things like the research findings from Teresa's paper. Those of you who have been working in Delta states, for example, have been coming up with some innovative ways to stretch our thinking and how we address and also measure community level indicators. So for example, our friends at the Indiana Coalition created this neti spaghetti activity that they use with their coalitions, and a lot of us who have experienced it have started using it ourselves in other states, and folks who work in other states with my company adapted it for protective factors. And what it does is help a community coalition or a group of people who are coming together to address a problem like violence from many different sectors, so like public health person, a school-based person, someone who specializes in suicide prevention versus teen dating violence prevention. We all have our own worlds we represent and come from, and so this activity really helps you do a more kinesthetic activity with your group to have them see what the overlapping risk and protective factors are for some of these shared problems that groups are interested in. What I wanted to, I just got cut off at the top, but what I wanted to ask you all to try to do is, these are examples of the back of a card. These are examples of protective factors for two different issues. So, could be youth violence, could be suicide, could be substance abuse. I'm curious, what do you all think the four factors are, on the card to the left: family support and connectedness, connection and commitment to school, access to appropriate services in the community, and skills solving problems nonviolently. These are taken from the Connecting the Dots document that Teresa was referring to. What problem do you think those four protective factors are protective factors for? what problem does just that left card address? And maybe put it in the text box. If you know the answer right off, you could be sneaky and look at connecting the dots if you have it open or at your side. But I'll give you just a few seconds just to kind of think or talk among yourselves to try and guess. And then, of course, I'm going to ask you what you think the one on the right refers to. What problem do you think that refers to protective factors for? Great. So folks are saying maybe bullying, maybe suicide prevention, maybe sexual violence and teen dating violence, suicide on the left, bullying on the right. Yeah, these are all great guesses. And it's kind of a trick question because the whole point of this activity from which these cards are taken is to show the overlap between different problems, so the overlapping risk of protective factors for different types of violence. The way that this game has been adapted has been to extend it beyond violence to substance abuse, mental health, other issues that other community partners might be addressing, so beyond the Connecting the Dots document that focuses just on violence factors. And we're able to draw some interesting connections for your partners to consider. So to the point that the person was asking about how we use connecting the dots with coalitions, this is one way that Indiana's coalition and then a lot of the Delta folks have adapted it, have used it with their group work. So the one on the left actually lists protective factors for substance abuse, and the card on the right lists for the protective factors for teen suicide. And you'll notice that there's 3 of the 4 that overlap. They have the exact same protective factor. And so it becomes really clear to your partners that, wow, really, if we focus on family support and connectedness, we'd be preventing both substance abuse and teen suicide. And you can draw these connections across a variety of different problems and issues. And I highly suggest you reach out to your other partners in the prevention community. Those folks are on the call today, and I'm also happy to help connect people to other resources. But your state coalitions have done a lot of awesome work trying to make this come to life. You'll also notice that there aren't that many community-level indicators in this game. And so with today's call, I guess I'd like to put a call out to our national community, that it's time to try and add those protective factors and risk factors that Teresa has listed out so nicely for us to games like this, so we can really push the envelope and yes, talk about like individual skills solving problems nonviolently. That's important to still focus on, but we can also start including things like collective efficacy and community level indicators that we can start measuring. One distinction I wanted to make really quickly relates to our use of the social-ecological model, and that is keep in mind, and this is how you keep things feasible a lot of the time, keep in mind that there's a difference between the level at which you implement a prevention approach or strategy or program and the level of the social ecology at which you expect the change to occur. Sometimes it's the same level. Sometimes you implement a relationship-based program with people together in relationship, and then the outcomes you're measuring and the impact or change you want to see are relationship level change, like communication between the 2 people. But other times, and most often when you're doing comprehensive prevention, which is what is really the most effective type of prevention, you're going to be doing programs and efforts at a level of the social ecology that are going to create change at a whole other level of the ecology. And so one example that we've pulled together with Coaching Boys into Men is this idea that, it's technically thought of as being implemented as a relationship level program. But when you look at the impact of Coaching Boys into Men, it has impacts potentially across the entire social ecology, including the community level. And so even though a lot of the measures that we're still using for Coaching Boys into Men are individual level, they're not the community level, although some of them are, like norms, you can help your team differentiate between the impact and where you're implementing something so that you're very clear when you talk about community level indicators. Okay, does that mean we have to do a community level program or approach, or is it just where the change is happening and that's where we're measuring it? I'm not going to say too much more because this could take us down a whole different road, but I thought it was an important point to highlight to help us think more feasibly about implementation level versus change level when we start talking about community level indicators. Another way to keep things really feasible is to think about this idea of data. I love that Teresa's team's paper really focuses on existing databases, population level indicators for community level indicators. It's such an opportunity to save resources and not have to collect individual level information like surveys and interviews. You can look at things that exist already, like employment records, or like a school climate connectedness survey, or housing data. Some of those examples that Teresa gave as the data sources are great. You can also consider adding an item to existing data. So make sure that there are questions that address the populations you're looking at when you're looking at economic indicators in your city. You can look at, of course, if you're collecting new data, you can look at adding questions to School Climate Connectedness Survey or RBS. Again, those would fall into a little bit of a sketchy area where they're good to use, but they're also, they have that measurement bias of just aggregating individual level students or youth impressions and making it a community level indicator. It's okay, but it's really not terrific as far as measuring a community level indicator. And then, of course, and Teresa touched on some of this, there's new data. New data is awesome and also, like we said before, time-consuming and can be very expensive, but also can be very excellent. So some of you have heard of a windshield survey where it's literally observing what is going on in a community, so you can drive down a street or walk down a street and notice the number of broken windows. Teresa referred to an indicator related to broken windows. Those are pretty neutral indicators to be using. Something like that is not as resource intensive, but it's still collecting new data. So just be aware of whether you're actually collecting new data or can you leverage your resources and look at data that already exists. And that data that already exists is oftentimes referred to as secondary data or PROXY data. Secondary data is data that has already been collected and you're using it for a certain purpose, basically. So, for example, social capital, this is more of a proxy example. Social capital, if you're wanting to look at social capital, instead of surveying individuals at a neighborhood block party, which I've done, it's great, it's a fun experience, and I'm going to talk about it again in a few seconds. It also was a lot of resources to do that, and there's certain people that are missed. And so a way that you can use what's called proxy data is to look at data that already exists, it's secondary, and it's also proxy, which means that you can look at voter turnout records as a proxy for social capital. So you may remember Teresa mentioned that social capital is, it's essentially the extent to which people trust one another in a community. And of course it has a lot more to do with it than just that. But voter turnout records imply something related to that, whether or not their voice is being heard, they're coming out to actually vote and participate in their civic engagement. Another example of proxy data is to think about if you want to be measuring diminished economic opportunity, which Teresa touched on as well, that's a community level indicator. Instead of surveying residents of a community, which would be the most expensive option, I would say, try a variety of other proxy data. So try looking at instead unemployment rates, or graduation rates, or salary data, or even legislation that's related to pay equity. Those can all give you an indication, right? That's what an indicator is. They give you an indication of diminished economic opportunity, and somebody else has already spent the resources, and it's probably a government or large foundation. They've already spent the resources to collect that information and summarize it for you.
This is super helpful. Can you share some resources that folks can look at for existing data?
Yeah, we live in an awesome time, or it's beginning to be awesome. Maybe I'm biased because I was used to so many years ago when we had such a dearth of information at the community level. But there are some really interesting resources available now. And so there's a few that I wanted to offer as an example. And I'm sure some of you have other awesome examples. Feel free to share them in the text chat Like I said, you all are the experts in what you've been doing to apply this work of community level indicators and figure it out in your community, so share with your colleagues if you can. For example, 3 main resources I just wanted to throw out there were any kind of dashboards or scorecards that your state or county or other population level entity might be keeping track of. So we talked about this a little bit before, but they're usually put together by a group that's trying to address a certain issue, and they've found different indicators, oftentimes at the community level, that they are tracking over time, which means usually over years, and using data like rates of poverty, things that are these indicator data that we were talking about before that someone else has collected that you can quickly reference. One of the big draws towards dashboard scorecards in the last 4 or 5 years or so has been because of the rise in collective impact as a framework for coalition building in communities. Collective impact is very data-centered and oftentimes uses a dashboard or scorecard approach to quickly presenting the status of a list of indicators related to a problem. It's so popular, in fact, that there are now online resources like the Community Indicators Consortium that have found all these dashboards across the country and give you a quick link to what they are. So here's a screenshot from the Community Indicators Consortium page, and it's alphabetical, and they have hundreds of different community-level indicator projects listed. So you would click on whichever one looked interesting to you, and then it takes you to their community dashboard or their list of indicators that they're tracking over time. So this is a great way to get ideas for the kind of indicators that you could be tracking at the community level. It also is a great way to tap into resources even in your own state or community that you may not even know exist. This work gets big fast. We're talking about poverty, racism, structures that the field of domestic violence and sexual assault has not typically touched on with regard to prevention. And so looking at what's already existing in your community is absolutely key. You should not be doing this from scratch. There's somebody in your community that is probably already looking at policies related to poverty, housing. Go find them, talk to them, find their resources. What are they measuring? This is just another screenshot of the way that you can search for different indicators. There are many categories you can search for indicators by. And I wanted to give a shout out to our Delaware folks and Lauren Camphausen, who's on this webinar. Delaware has some awesome resources like I was just talking about. So you can click on indicators for their Delaware Household Health Survey. So the state of Delaware has put resources to doing a population level survey. And so they've made those findings available for the public to look at and use in their own reporting. And you can use data that you find from a state source like this in a dashboard. So this is an example of a dashboard that's used by an initiative in California. It's a statewide initiative in California that presents data on indicators. So the indicators are on the left, so 1, 2, 3, 4, 5, 6, 7. There's an arrow on this slide pointing to the indicator children who are not living in communities of concentrated poverty. So that's related to the indicators that Teresa was talking about. Then you'll see with the arrow to the right, it breaks it down by race and ethnicity, which I thought was helpful, and also shows the change over time. So where the project started tracking it and then where it is in the end. Alaska has done something similar. I know you can't really read this, it's too small, but just visually to show you, these are categories of indicators for domestic violence and sexual assault in Alaska. And every year, the state of Alaska populates this one-pager. There's actually more than one page, but this is a key cover sheet for it, with the most recent percent of whatever the data indicator is. And then over time, you can look at percent change. So this is an example. These 2 slides are examples of dashboards or scorecards.
Thank you for really getting to the core of it and providing some really helpful resources and showing how to go about doing some of this. To really now connect the dots to some of the stuff that Teresa shared, do you have any examples of measuring any of the factors from earlier on?
Yes. As I promised before, we were going to touch on an example related to what Teresa was talking about. She was talking about community-level indicators such as social cohesion, social capital. There's also collective efficacy. In our work with the Idaho Coalition Against Sexual and Domestic Violence, they were a previous Delta grantee with the last round of Delta, and a lot of other Delta states at that point dug into what does it mean to actually measure something like collective efficacy, because there are now publications, there's published findings that show, as Teresa mentioned, collective efficacy plays a role in rates of violence in a community. And so it'd be important to figure out what is the level of collective efficacy in my neighborhood or in this community. And like I mentioned before, remember to look at other neighborhood initiatives that already exist, because they might already be doing it. In Idaho, there was already a neighborhood initiative in Boise that was focusing on this neighborhood in Boise that we also were focusing on, that already was organizing block parties and trying to build basically what we would call collective efficacy. And so the Idaho Coalition partnered with this local neighborhood coalition to improve the neighborhood and measure things like collective efficacy. So it was a win-win for everybody. And it would make no sense for the Idaho Coalition just to go make everything up and do it on their own and do neighborhood organizing in that sense. Or, I mean, it makes sense, but that's a lot of resources. And it also isolates the issue of domestic violence, sexual assault. Why not work with people who are already addressing some of these issues of housing and efficacy in your community? So collective efficacy at the neighborhood level is basically the willingness of residents to intervene for the common good. It's a combination of social cohesion and social capital. And it's kind of a hole you can fall into when you try and dig through how all these things relate and are defined. Psychologists are figuring it out now. But in its most simplest sense, that's what collective efficacy is referring to. And this is a picture of the way the Idaho Coalition decided to go about measuring it. Like I said, we partnered with a local housing coalition, a neighborhood improvement coalition, at one of their block parties to survey residents. And we did a survey on iPads. We made it available on paper. We had translators and collected primary data. So again, this is more time consuming than if we were looking at data that had already been collected by someone else. Because we had our own data, we were able to give them back a pretty little infographic that gave some of the results related to collective efficacy. So what percentage of neighbors agreed or strongly agreed that people in their neighborhood would be willing to help each other? How much do they feel people in their neighborhood generally get along with each other? Are there safe places to gather outside of school hours? How many people would step in if they saw bullying happening, right? These are all ways to measure. They're part of this construct of collective efficacy that, as Teresa mentioned, is one of the community-level indicators. But here's my question to you.
Oh, yeah, go ahead.
Yeah, I mean, how would you measure collective efficacy using this idea of PROXY or secondary data, or basically data that already exists? It took a lot of resources to collect fresh data at a block party, and we only got 89 responses. So what's another way that we could be measuring collective efficacy at a neighborhood level that's not collecting it from a survey like that?
And we invite you to use the text chatting on the side and reflect on some of the other things that have been shared today, and really think about what some of that PROXY or secondary data might be. So I see there's already one comment about voter turnout, which I think was shared earlier on in the session as well. Yeah, looks like we have more agreement on that. School connectedness surveys. And
Great.
While people's answers are coming in, I thought that maybe I could ask a quick question of you, Wendy, that came up earlier with regard to how do we bridge program level evaluation indicators with these related community-level indicators when much of our work still occurs at that small-scale, program-specific level, i.e., how do we build strong, clear logic models to help bridge the work?
Ooh, you almost gave away the answer, I think, at least the way I would answer it, with referring to a logic model. The more and more I do this work, and I know many of you on the webinar can attest to this as well, I find the importance of making a model, or conceptual model, or theoretical model that explains why you're focusing on changing certain factors in a population or your community, why that would lead to eventually reducing rates of violence. As Teresa and her colleagues make a good point of in their paper, and this is also widely practiced in general with prevention science, I'm focusing on intermediate factors, so these risk and protective factors that make a population or community more or less likely to experience the problem are super important because those are within the grasp of most of your efforts to implement programming. They don't necessarily, you can't just jump to reducing rates of violence without knowing the factors that lead to it. And so over the last 12 years, 15 years, we've been learning a lot more about the factors that lead to domestic violence, sexual assault. But mapping that out is so important for your community or for your group that's working on this, so that you can explain how, even though you're only focusing on maybe 3 community-level indicators or programs that are going to address 3 community-level indicators, overall, eventually, after a number of years, it's going to actually probably reduce rates of violence. It may not happen within the timeline of your specific project or funding, like 3 or 5 years, but it's really important to put the logic behind it and why you're addressing these certain indicators. And I also and I would love to hear Teresa's comment on that as well. But I also just want to put that reminder out to remember that program evaluation is really focused on improving your program. And so it's much more advanced as far as how much data you collect.
Yeah, so this is Teresa. I was going to ask, can I jump in? Too? So that's
yeah,
great.
I was going to say that as well.
Yeah, if you're, and I saw who asked that question. I see you. I know you, Lauren. So I would also say that if your specific program or approach is at a neighborhood level, some of the indicators that we did share were measured at a census block or census level, right? So you can get community level indicators down to the neighborhoods in which you're working. And then if you want to be able to demonstrate, maybe how your neighborhood is shifting and changing over and above or differently than a nearby neighborhood, you would look at those same indicators, census tracts, in either, an adjacent or some kind of nearby or comparable neighborhood. So I do want to say that, yes, of course, you bridge the gap in the logic model, you look at risk and protective factors and everything Wendy said. But if there's an opportunity to kind of make that leap to community level indicators, I would suggest that you guys consider it, and remember to the point that Wendy has reiterated over and over again, and I hope I said as well, we know that the prevention takes time to show impact on violence outcomes, so that's why we're tracking. That's one of the reasons why I think tracking risk and protective factors could be helpful. But there are community level indicators that can go down at that level of the community in which you're working, or in which the organization or the school that you're working with the youth. So I think some folks also do school district level work, right? And so you can get indicators at a county or a district level as well. Just want to put that out there.
Yeah, that's great. And before we move on to resources and tools from the session, I just wanted to ask our 2 guests, Wendy and Teresa, to share any final words. I put up some of the tips from across the slides that you've shared so far today, or that you shared today. But yeah, any closing thoughts, words that you want to leave the audience with?
Wendy, you go first.
I was waiting for you. I mean, you see some of our tips that are on the slide in front of you. I guess one additional thing that I wanted to remind folks of that I said I would kind of get back to when I was talking at the beginning was the idea of interpreting data. I can't emphasize enough how important it is to know where data comes from and to know how it's been collected. Somebody brought up the really good point of structural racism and how that is reflected in data earlier in the text box. And that's such a very important, valid question to ask. So don't ever not ask because you're intimidated by a researcher or by the language that's being used in a publication. Find someone that can help you interpret what they're saying their research is showing you and how that data was collected, because we're finding more and more that big data, you know, it's referred to as big data because it's like big databases that are population-wide, can still have some bias. Like we look at them as neutral indicators, and hopefully they are. But for example, we know just this last month, in May, Amazon came under some fire because they're invested in facial recognition cameras on street corners, right? And they're finding that those images, even though artificial intelligence, like machines, are using the facial structure of people from the photos that are being captured from those cameras, because of the data that was put into the machine about what a face is built like or what a face looks like, they're actually coming out as being kind of biased towards women and people of color, which actually has an impact on the number of police stops and arrest rates for women and people of color. And so something that seems very innocuous and big data, like, oh, it's just some computer working on something, some human being had to put that question or put that definition into that computer. So it's always good to find out how that was being defined. And we could do a whole webinar just on this, but I just wanted to encourage people to keep that in mind, that this kind of data is really helpful, that oftentimes decision makers and policymakers believe in it more than if you had done your own survey. They'll trust the state database more. But somebody had to figure out what questions to ask in that database, and somebody had to collect that data at somewhere down the line. So it's good to always know where it came from.
I'd agree with that. And then my final last words, I think, are, don't be afraid to be creative and innovate, because I do think that, and we mentioned this in the discussion section of our paper, but there's still so much we don't know. And there are a lot of community-level indicators that we have yet to explore, or just community phenomena we have yet to understand as it relates to our work in preventing violence, intimate partner sexual violence, and other forms. And so, for example, some communities are facing what do we do around prisoner reentry, and what does that mean for our communities? And I don't mean it in a negative way. Again, I'm talking neutrally for a minute, right, without value. But this idea that we have members of our communities that are not, to Wendy's point, being represented or being captured, and even in our own research, right, and the indicators aren't there yet. But that doesn't mean that we won't get there, and that doesn't mean that you guys couldn't help us, the field couldn't help us researchers and get there. So just, be, of course, talk it over with folks, but, be creative, be innovative, be bold, because there's still so much more for us to know, to understand, to explore, and there will always be something that each of us as individuals aren't thinking of, but someone else might be. And so that's why it's always great to be doing this work together and to share what we learn together with each other. So I really appreciate the time that was given to us to share with you all today. And again, please do not hesitate to reach out if you have any further questions.
Yeah, and thank you both for your willingness to share and being open to doing that on this platform today. I can see from the text chat that a lot of people also appreciate what you shared. So for tools and resources, we have Wendy's email listed here, as well as you can check out Strategic Prevention Solutions website. Wendy also included this worksheet. Do you have anything you want to say about this, Wendy?
I forgot about this worksheet. It's just a worksheet that's available online for those of you who are embarking on evaluation, to walk through the steps of actually getting to the point of using your evaluation data. So especially with community level data, think about how you're going to access it and how it's going to feed back into your evaluation. And that helps you think about your capacity. So you can make decisions about whether you have the capacity to collect new data or whether you really should be looking at that secondary or proxy data.
Oh, neat. That's great. And then we also have Teresa's email listed here, as well as you can check out the research article that Teresa and her team researched and wrote. So we also have Teresa's contact information and, of course, acknowledgments to her co-authors. And then some other tools that have been surfacing in the field. There's the Evaluation site from the Centers for Disease Control and Prevention. The National Sexual Violence Resource Center had a report that came out not too long ago on innovations in evaluation, so you can check those out as well. But again, I really want to thank our guests, both Teresa and Wendy, for everything that you shared today, and I'm looking forward to future parts to this in the future and seeing how practitioners and advocates on the ground are starting to look at community level indicators in their work. So with that, thank you very much. I'll hand it over to Ashley to close us out.
Thanks, Alicia. Well, just echoing your comments, thank you again, Teresa and Wendy, and thank you to everyone who participated in this web conference today. There was some great discussion, some good questions, and resource sharing. And so, Alicia and Carmen, thank you so much for the work that you did to make this possible. You all will be receiving an evaluation survey in just a couple of minutes. At the end of that, there is a link to a certificate of attendance, and we really do value your thoughts on our web conferences, so I encourage you to take a few minutes to respond to that. I will also send out an email when the recording is available and the text chat, so you should see that from me usually in about a week, but I just wanted to thank you all again, and I really loved, Teresa, your sentiment about the need for creativity and innovation. Prevention in general really requires us to be creative and innovative, and I know that there's so much of that happening across the country and outside of the country, really, so it's wonderful to get to dialogue with you all. I hope you all have a good rest of your Wednesday, and we will talk with you in July. So this concludes our Prevent Connect web conference for today. Take care.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.